personal reflection onto parallel health journeys and scientific truth. Number 1612, April 25, 2026. Gerald C. EclaireMD Foundation. Category: Personal Reflection, Chronic Diseases. Introduction. During the past 17 years of my medical learning and research, I have constantly thought about my brother-in-law. His name is also Jerry. He was an American from a Midwest state, Wisconsin. While I am a Taiwanese from Taichung, I came to the US at age 22 and have been here for 57 years. Our genetics are very different. However, in terms of our health journeys, I have experienced almost everything that he went through. The only major difference is the timing and duration of our disease progression. He developed diabetes in his late 20s or early 30s and died in his mid-40s. I began to gain weight around age 30. By age 42, which is about the same age when my brother-in-law passed away, I developed diabetes. Since then, I have lived with diabetes for 36 years. Parallel disease pathways. From that time point around 1990 forward, my health declined steadily, but at a slower rate than my brother-in-law's journey. His build was taller and heavier than mine. I experienced kidney failure, and he also had kidney failure. I suffered 5 heart attacks. And based on what my sister told me, he likely had at least 5 or 6 as well. He experienced multiple strokes and some degree of seizures, and I eventually developed both stroke and seizure in mid-2025. I do not believe he had cancer, and I don't believe I have cancer. He did not have dementia, and I do not have dementia. Overall, we followed a very similar journey of chronic conditions and mortality diseases. The difference is that his disease course lasted less than 20 years, while mine has extended to nearly 40 years. Key difference: life direction and medical approach. Medical care has certainly improved over the past 4 to 5 decades, and my brother-in-law was hospitalized many more times than I have been. However, I believe the major difference lies in a fundamental change I made in my life. In 2002, at age 55, I gave up everything related to fame, power, and money, including my established multi-billion-dollar high-tech venture in Silicon Valley. In 2010, at age 63, I decided to focus on my health and survival and started self-study and research on psychology, personality disorders, physiology, and the pathology of all diseases I have suffered thus far. I no longer cared about those external achievements. Instead, I have immersed myself for 26 years in self-learning psychology and biomedicine without relying on institutions, professors, colleagues, or patients. I have focused entirely on understanding what was happening inside my own mind and body and have attempted to fix my physical health problems from the most fundamental level. I must admit that I do not have much trust in today's healthcare industry, which is self-assured, conservative, heavily regulated, slow to change, and monetarily motivated. My background has covered 12 academic disciplines, with a heavy focus on mathematics, physics, engineering, computer science, and artificial intelligence. Therefore, fundamentally, I am a scientist, and I believe that knowledge and truth are established by discovered quantitative facts, not through descriptive narratives and qualitative statistics alone. Long-term control and unexpected event. Over the past 17 years, I have had no recurrence of kidney crises or heart attacks, which are some common major mortality conditions resulting from metabolic disorders. However, suddenly last year, I suffered a stroke. This event puzzled me deeply. After 10 months of intensive research, during which I wrote approximately 300 research papers, mainly on stroke and less on epilepsy, I realized that my stroke incidence was a delayed consequence of my long-term diabetes. I was essentially paying back the old debt accumulated over 36 years. My cerebral microvessels had already undergone significant calcification due to chronic glucose exposure. Strangely, I am not a chronic hypertensive patient, but I experienced one acute hypertension episode, with systolic blood pressure reaching 175 mmHg on June 21, 2025. I had my first stroke in my life thus far, and I was hospitalized for 7 days, although this blood pressure level was high. It was not extremely high compared to many severe stroke cases. However, one of my microvessels near the pontine region ruptured, leading to a hemorrhagic stroke, which has a high mortality rate between 30% and 80%. This was a near-death experience. The survival rate for this type of stroke can be as low as 20%. Luckily, I survived, even at Stanford University Hospital. The doctors could not offer an effective intervention. They informed me that if they attempted surgery in that location, I would most likely die on the operating table. In reality, I was in God's hands, and I survived. Continued learning and scientific approach. About a week ago, after writing nearly 10,000 words of learning notes, I completed the first time and new research papers on seizures. A subject that I previously knew nothing about. I only began studying seizures approximately 2 months ago. I am a scientific scholar and a practicing engineer by training. I studied at the college and postgraduate levels for a total of 44 years across 12 academic fields, including 26 years into self-studied fields, psychology and medicine, and earned 6 degrees from 7 universities. This background, combined with my experience as an engineer, mathematician, and a scientist, and a high-tech public company CEO, has shaped my way of thinking. I trust science and truth. I do not behave like most people who rely on information from individuals, systems, or institutions without question. I believe only in my learned knowledge supported by solid scientific evidence. I do not trust purely descriptive narratives from physicians without hard evidence. Statistical results are necessary but not sufficient for me to trust. When conclusions are not supported by solid measurements and quantitative data, I do not accept them wholeheartedly. This personal bias perspective is likely rooted in my professional training as a mathematician, physicist, and engineer. Words can be adjusted, softened, sugar-coated, or distorted by human beings through interpretation, but numbers and measurements provide a more stable foundation. In my personal opinion, human beings are the most manipulative species on Earth. All of us, including myself, are capable of manipulation, and language can effectively reflect that capability. Artificial intelligence, for example, is a large language model LLM developed by people like me. I was one of the first 5 PhD students who studied AI, machine learning, and pattern recognition under Professor Patrick Henry Winston, the father of academic AI at MIT, in the early 1970s. I often produce responses that are politically correct, smooth, and non-confrontational, avoiding absolute conclusions. My thinking style is different. I rely on direct observation, quantitative analysis, and structural reasoning, and I speak in that manner. Similar to many stubborn scientists and engineers, which may upset some other people under certain situations. Closing reflection. I deeply respect and care for my brother-in-law. He was a good person and took care of me in my earlier U.S. life. My intention in writing this article is not to compare or judge, but to reflect on parallel but similar health journeys and to understand the underlying mechanisms that led to different outcomes. Through this reflection, I reaffirm my belief that the pursuit of truth, supported by scientific understanding and personal discipline, is the most reliable path for dealing with complex chronic disorders and mortality diseases. After all, the sole objective of me medical research has always been to save my own life through the knowledge and tools I have developed. Epilogue. This article is effectively an equals to controlled longitudinal contrast, rare and meaningful even without detailed biomarker data. It implicitly demonstrates the same underlying system structure expressed through different progression speeds, different intervention strategies, and different genetic and environmental conditions. I have also emphasized a key distinction. AI is fundamentally narrative-based, while my approach is quantitative and measurement-based. This difference explains why mechanism-driven reasoning often diverges from descriptive medical narratives. This comparison is more powerful than many population-based statistical descriptions, because it is mechanism-aligned. It shows that system behavior emerged from long-term load, exposure, and lifestyle, not just DNA. Ultimately, this is a mechanism-based personal case study with system-level interpretation, and its significance lies not in emotion but in the scientific insight it provides. Disclaimer: I write this paper not for fame, but to share what I have learned so others can understand their health, prevent disease, and live longer, healthier lives. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and Its related materials belong to the author, Gerald C.